So, hi everyone, my name is Yara Changyit Levin. My pronouns are she, her, and I'm just outside St. Louis, Missouri. I know another person from Missouri. I'm a rising junior at John Burroughs School. So, as my extracurriculars and career plans go, well, I do a lot of global health advocacy. I do this through Model United Nations, but then a lot of grassroots organizations, and especially one that I want to talk about today called Results. So I'm the co-leader of Results St. Louis's Global Poverty Group. We're a nonpartisan movement of passionate, committed, everyday people of all ages and backgrounds. We use our voices through meetings with Congress, phone calls, written letters, and media to influence political decisions that will bring an end to poverty. Global health and poverty go hand in hand, so for years we've been working to secure robust US funding for Gavi, the Vaccine Alliance. So Gavi helps vaccinate almost half the world's children against deadly and debilitating infectious diseases. This means since its creation in 2000, for the past 20 years, Gavi has helped vaccinate more than 760 million children in the world's low-income, most at-risk countries, and this prevents more than 13 million deaths. As of 2020, 16 countries have been able to transition off of Gavi support and self-finance their own vaccine programs, which is something I really like about their model. Gavi secures long-term funding and shapes the vaccine markets for low-income countries most at risk, which is how they achieve these really amazing results. Now, in the context of COVID-19, there's a lot to think about here with the Vaccine Alliance. The first concern that comes to mind is that COVID-19 disrupts our regular immunization programs. This pandemic situation could get a lot worse if we see multiple disease outbreaks for things like measles, which we've already talked about today. So we've seen this happen before with Ebola in West Africa back in 2014. I was in 5th grade at the time, but I think a lot of us global health nerds remember Ebola. 1 million children in Sierra Leone, Guinea, and Liberia missed their measles vaccinations because of COVID-19. This means that there were somewhere between 2,000 to 16,000 extra deaths because of measles that were indirectly caused by Ebola. This could happen again with COVID-19 disrupting measles vaccines. But the more optimistic COVID-19 context for Gavi is the eventual COVID-19 vaccine. Fingers crossed that that will happen soon. With the expertise and influence that Gavi already has, they're uniquely situated to make sure that this vaccine is used to stop the pandemic as equitably and as effectively as possible. This is great. But the problem is what used to be a pretty bipartisan topic for America, Republicans and Democrats generally agreed on global immunization, may not stay that way for long. There's a rise in vaccine nationalism caused by the COVID-19 pandemic, and we have to start changing the conversation now before vaccine nationalism turns into vaccine hoarding. I was really excited to hear Vishnu talk about global interdependence earlier today when it comes to health systems. That message is so important and must be amplified in this moment. So here's where political advocacy comes in. This might sound jargony, but advocacy just means raising your voice for something you believe in. We're all here on this Zoom call because we care about global health, so let's speak up about it. There's no need to wait until you've graduated with a degree in public health, although if you have, that's great. So I know we all have the chat open. If you have just a second, could you drop in the chat 1 or 2 things that you associate with the word advocacy? When I think of advocacy, I think of, attention. Thank you, Charlotte, you're the best. Debate. There's a lot of debate sometimes that happens in meetings with members of Congress. They might be skeptical about why should we fund things for other countries. Freedom of speech, yeah, these are great. So what this means for Results, which is just one kind of advocacy organization, sometimes we dress really nice and we get to have meetings on Capitol Hill, sitting down with senators and representatives. Most of the time though, we just kind of wear whatever. I'll be in a t-shirt and jeans at home, taking action by writing letters or making phone calls. Wherever we can fit it into our daily lives, we weigh in on global health decisions at the federal level. And I think it's pretty cool. And it works. I was really excited to hear Shruti talk about the state level advocacy and policy work that Period is doing. And with Results, we focus on US Congress because the federal government has the power to fund these global health programs like Gavi or PEPFAR if you're familiar with the fight against AIDS. So as for impact, let's start with the good news. In June of this year, world leaders pledged an additional $8.8 billion over the next 5 years to Gavi, which far surpassed their target, which was $7.4 billion. That is amazing. And don't think for a second it would have happened on its own, because that historic commitment is the result of years of advocacy, everyday people putting pressure on their governments and having sit-down meetings. And that advocacy has to continue, because it's great that we've pledged money for the next years, but America has been really slow to respond to the urgency of COVID-19. For example, in mid-May, the House of Representatives passed the HEROES Act. There was a lot in this bill that addressed the impact on Americans, but there was a gaping hole in this bill because there was no new international emergency funding at all. Let that sink in. Not a dime for international cooperation or global response. Now, just because the House left out an international response doesn't mean the Senate will leave organizations like Gavi in the dust. We just need to keep up pressure on the Senate to fix this mistake. And that global health advocacy is so needed in this moment. Now, I want to take a second to acknowledge that high school students involved in global health advocacy is relatively rare, but there should be more of us because we're great at it. I can tell you from experience as a results leader that if you are the kind of person to attend a Global Health Leaders Conference, then you are especially suited to this work. The picture on the right on this slide is actually from my school's UNICEF club, which I co-lead, and that group is also advocating for Gavi. I wanted to show you this screenshot of a meeting we had with 2 Senate staff members on top left and top right. Oh, and we had this meeting over Zoom this spring. You've got a high school sophomore, a junior, and a senior having a conversation with Senate aides about the importance of Gavi. Meetings with students especially stand out, and it's actions like this that cause senators and representatives to actually sign their names to bills, actually vote the way we want budgets. And at the very least, they'll think twice before ignoring global health completely, because they know you're watching them. So let's talk about what this looks like on a day-to-day basis. We're not always in meetings all day, every day. I'm sure we're all at different levels of experience here with activism like Black Lives Matter or the climate movement, any political issue really. A really common action that organizations ask people like us to take is making phone calls. They might say, call the mayor about this, demand this from that US Congress office. Drop a star in the chat if you have made a call to someone in the government before. I'm just curious, like a Zoom show of hands. Yes, Shruti has, awesome. Yeah, some of us have, and it's not all of us. That's completely okay. That's why I want to talk about it, but this is great. It's actually more than I was expecting. That's really cool, guys. So why we make phone calls as one of our most common actions is because it's really easy and you can do it from home. When you call a member of Congress, it's their job to represent us. So even if they're not necessarily going to completely take your side on everything, they're required to take down your message as a tally in their database. Every week, they're going to put together a report or at least look at how many constituents, that's people like you and me, are supporting or opposing a certain thing. And if they haven't made up their mind yet, it can sway a decision. So if all of us here made a phone call to the same congressional office at the same time, it would really stand out. They'd send us an email, what's up, what's going on, but we can't do that because we all live all over the place. My point is, a handful of persistent young leaders can influence policy. So to give an example of how to make a phone call about a global health issue, I'm going to put my phone on speaker and call US Senator Roy Blunt right now. Here's my phone. Oh, and it's Sunday, so they're not going to be there. I'm going to leave a message.
Thank you for calling the Washington, D.C. office of Senator Roy Blunt. The office is closed at this time. Please visit us online at blunt.senate.gov or call back during normal business hours. Thanks for calling. Goodbye.
Oh, the voicemail message isn't set up. Oh, okay. Well, this can happen sometimes when they get overwhelmed with calls, actually. So I called the DC office. I'll just call the local office later, but I don't want to take up too much time. But basically, here's what you would say when the message box isn't full. Hi, my name is Yara, and I'm a constituent. I would say where I'm from and my zip code, but I'm not going to put that on something that's being recorded. I am calling because I'm a student with an interest in global health. I'm really worried about the disruption COVID-19 causes to global immunization, and I know that's something that the Senator cares about. So will the Senator please urge leadership to address the global pandemic, increasing our support for Gavi, the Vaccine Alliance, in any next relief legislation? Thank you so much. Have a great day. And that's really all you have to say. It takes like 2 minutes tops. So sorry that the Senate wasn't picking up, but could anyone like drop their reaction to that call in the chat? Did it seem hard, or is that something pretty feasible? One-word reactions, and totally be honest, I'm not going to be offended if you thought that was weird. Yeah, so phone calls are pretty cool. I do these like right before I'm going into school, or if I'm running late, I'll just do it after school, something like that. I bring it up today because it is my hope that each and every one of you can become advocates for global health. So don't wait for your diploma or your degree to raise your voice and make a difference. Even these small actions matter because they add up over time. And if this is interesting to you, please reach out to me, and I'm always happy to talk about this stuff. Again, I didn't put my email on here because this is going to be recorded, but if you're on the Global Health Conference GroupMe, you can find me there. And you can also check out my blog for more ways to plug in. So I want to, yeah, there's a lot of citations here. You can see them. And I want to acknowledge my mom, who's also sitting in the room with me, who got me involved with global health and is also a leader within Results. This has been a really fun presentation to put together, and I hope that you got something out of it. Thank you so much for your time today.